This is the posterior thighs. Here, the sciatic nerve, piriformis comes down this way, comes down this way. The hamstrings are intact here. Here's the medial hamstring. Here's biceps femoris. You can't see the sciatic nerve here. The hamstrings are taken off here. There's adductor magnus underneath it. This is where it separates into the CP nerve and the tibial nerve. Notice that this is looking at somebody whose feet and head are away from you on the table. This is adductor magnus. Here's a sciatic nerve. It's Mickey Mouse or it's a ghost or something. And here's on the left side, this is the medial hamstring. This is the lateral hamstring. So we're going to get into the junction of the hamstrings. We're going to start down low. We're going to come in here. First, the question is can I get into the junction? If I can't get into the junction, we're going to feel stuff in the way. So that stuff will be blocking us from getting deep. You might notice in one spot you can get deeper, in one spot you can't. There may be a junction adhesion in there. So yesterday on James, we were able to get into his junction. On Ben, we weren't able to get, he had some gigantic junction adhesions. Then on James, we were palpating, so you're getting in here. Then I want you to sink your thumb in there to the nerve, and I want you to go like this, as if you're trying to get underneath this hamstring, and you're going to lift it off on the medial side. Then you're on the lateral side, you're going to get under this, and you're going to try to lift it off. You're trying to feel this edge. So we tried to feel the edges of the nerve, because sometimes you can get to the nerve, and you're like, I feel a density here that feels different than a muscle on the sciatic nerve. Then if you wiggle your thumb, you'll start to be like, oh, that's an edge. Oh, that's an edge. So I can imagine that the rest of the nerve is like this, which that's what it is. For the hamstring, you're getting in here, you're appreciating that it's its own piece of long meat, whatever that is on the cow. So on James, we were doing this yesterday. He had one spot up high where his we could feel the edge, we could feel it moving, and on one spot, the edge was stuck right here and would not go, but you could still feel the clean edge. Very clearly, we knew that the hamstring was stuck to the sciatic nerve. So we're going to come into the junction, and you're going to see if you can appreciate the different pieces of meat that you're trying to separate from each other. Is there something in the way, a junction adhesion? Then you're going to try to get underneath here and lift off the hamstring as if it's, because these are two separate tissues, and it should be able to lift off. And you're going to appreciate that up and down the hamstring. So first you want to be mindful when you're in this position. Sometimes when my hip or my knee's bothering me or ankle, I'm going to be like this. Sorry, Greg. And what is this? External rotation, which is going to give me a weird angle to get in here. So right now my knee feels okay. So I'm able to get like this, and I'm a little bit off to the side. Now, if I come down here, I want you to pay attention to spaces and borders. So right here is the popliteal fossa in here. When I sink my thumbs in, you can see that the hamstrings separate on both sides. The biceps tendon side, the semis tendons on this side. I'm in this space, the tibial nerve is right in the middle here. So if I keep appreciating this space and I crawl up, I can feel the hamstring tendons start to encroach on my thumbs. And I'm wiggling in here, back and forth, to see what this feels like and to appreciate if I can get into this tissue or not. And first I'll just do that, and I'll appreciate how deep I can get into the tissue. So this is a bigger hole. I'm getting deeper than I am down here. So there's likely a little bit of junction adhesion right here. And for some reason, I noticed that I like doing this thumb over thumb reverse thing, because I notice in certain areas I can't feel tissue one way, and I'll switch my finger another way, or I use the opposite hand, and all of a sudden something pops up and I can feel it. So there's something about, I'm moving the tissue on the lateral side by pulling, and I'm pushing with this side. So this side is pushing, this side is pulling. So when I go like this, I'm appreciating that direction. When I go that way, both of my thumbs are going that way, and I can appreciate it differently. So just in doing that, I can feel this side pulling has a little bit of sciatic nerve hamstring entrapment right on this side. I can't get under that edge as well as I can over here. So there's a little bit of entrapment right there. And then I keep wiggling my way up. And I'm appreciating, look, this is its own piece of meat right here. This, I'm sticking my fingers in there. This is the lateral hamstring tissue. Can I appreciate the borders of this? And then can I grab with this thumb, bent knuckle, using my fingers to push, can I get under the edge of this hamstring? Can I lift it off of the sciatic nerve? This is moving, see? I'm lifting the whole biceps off of the sciatic nerve. Not, do you see that? Not going. Lifting, not lifting. I can feel the edge, so there's no junction adhesion here. However, it's not lifting up. This is hypertonic and I can't tell, probably because of this sciatic nerve entrapment to the hamstring muscle. And then on this side, can I get under with this thumb, under the edge? Can I get to the sciatic nerve there, and can I get into that space deep in there in order to feel if it's actually stuck? And up here, this is just not going at all. So the sciatic nerve is stuck and entrapped there. So we have different strategies. I want you to practice using your fingers, and I want you to be conscious and mindful of anchoring in what tissue feels like. What does it feel like to sink my thumbs into this junction in this space? First, can I get in here, or does this just feel like one muscle? If this feels like one muscle, it's major junction adhesions here. Some of you may have that. But if there's a space, you can see there's a gully that I'm pushing into the gully. If you push somewhere and you feel like you're into a muscle belly, this is in the belly of the hamstring. It doesn't feel like a space. This is a space. So there's a ravine right there. And then how deep can I get to it? Can I get to the nerve? And then if I get on top of the nerve and I bias the hamstring, can I pull it off? So can I pull it off with one thumb? Or when I try to nudge it with both thumbs this way, what does it feel like? So I want you to appreciate the boundaries and the pieces of steak and the landmarks in the space, how deep you can, and can you lift the hamstring tissue off? And try to compare two spots. Don't worry about the whole thing. Can you find a good spot versus a bad spot? And if you could do that if you're new, huge win. Cool? And break.